Welcome to the ultimate resource for cat owners, the complete cat health guide for every life stage. From kittenhood to senior years, we'll provide you with comprehensive insights into your feline friend's well-being. Discover everything you need to know about nutrition, exercise, preventive care, and recognizing signs of illness. Join us on this journey to ensure a long, happy, and healthy life for your beloved cat, no matter their age. Stay tuned for expert advice and practical tips to become the best cat caregiver at every stage of your cat's life. Today we will talk about complete cat health guide for every life stage. So before we get started, make sure to hit that like button. Also subscribe to my channel. Many people consider cats to be self-sufficient, independent pets. But you might be surprised to know that cat health care requires just as much effort as dog health care. Because many cats are indoor only, and they're difficult to get into a cat carrier. Some pet parents may try to avoid veterinary visits with their feline friend as much as possible. This can lead to an increased risk of illness and disease, as medical issues may not be detected as early as they could have been. It's important to make sure that your cat has the proper veterinary care, vaccines, diet, parasite prevention, and mental and physical stimulation that they need from the time you adopt them. How to keep your cat healthy at every life stage. Don't let the amount of cat health information out there overwhelm you. While adopting a cat and committing to keep them healthy is a big responsibility, veterinary professionals are ready to educate and help. From taking your kitten for a vet visit to helping manage your older cat's arthritis, it is important to keep in contact with your veterinarian and have your cat examined annually to make sure they are in good health. You've fallen in love with a kitten at the shelter and are committed to a lifetime of care. While having a kitten is fun, it can also be a lot of work. Here's how to set your kitten up for success when it comes to vet care, dietary needs, flea and tick meds, and keeping them mentally and physically healthy. Nutritional needs. Your kitten has specific nutritional needs, such as more calories and protein to fuel those growth spurts. These needs can be met with kitten-specific diets. Most cats transition to an adult diet around 10 to 12 months of age, but you should talk with your veterinarian about your cat's specific needs. The most important thing to remember when transitioning your kitten to the adult stage is that they need fewer calories and less protein than they did when they were growing kittens. Food should always be transitioned gradually over 7 to 10 days, as sudden changes in diet can lead to upset stomach and diarrhea. Supplements. Something that every cat struggles with at least once is the dreaded hairball. Brushing your kitten on a regular basis can help reduce the amount of hair they ingest. You can also use a hairball product, such as KAT-LX, to make it easier for your kitten to pass the hairball. If you notice that your cat is vomiting hairballs more than once or twice a month, they should be seen by their veterinarian to rule out any underlying illness. Medical needs. Kittens are tiny creatures that require a lot of care, especially in their first few months of life. Here's what you need to know about their medical needs. Veterinary care. It is ideal to have your kitten seen by their new veterinarian within a few days of adoption, but at the very least, they should be seen within 10 to 14 days. Kittens should also be tested against feline immunodeficiency virus, FIV, and feline leukemia virus, FLV. These are both viruses that can be transmitted from a mother cat to her kittens, as well as from one cat to another via contact. Your veterinarian can perform a blood test to make sure your kitten is not affected by either of these viruses. Depending on how old your kitten was when they had their first vaccination, they will likely need to go see the vet every 3 to 4 weeks until 16 weeks of age or older. At this point, most kittens will be done with their vaccine series. Vaccines. Vaccination is a very important aspect of kitten healthcare. There are many serious but preventable diseases that your veterinarian will recommend vaccinating against. While many shelters will give the first round of vaccines, you will need to take your kitten to the vet to continue the series of vaccines. Rabies. The rabies vaccine is legally required in many areas, and kittens are vaccinated once for rabies at 12 to 16 weeks of age. Even if your cat is indoor only, you can never completely guarantee that your pet will never come into contact with another animal that could be spreading rabies. Rabies is a fatal disease that can be spread to humans too. For this reason, it is recommended that even indoor-only cats always stay up to date on their rabies vaccinations. Dental care. There is no exact answer for when your cat should have their first dental cleaning. Your cat's veterinarian will check their teeth at their annual wellness appointments. They will recommend a dental if they note gingivitis, inflammation of the gums, tartar buildup, or any signs of infected, broken, or resorbing teeth. Your kitten should not need a dental unless they have retained kitten teeth that need to be extracted, or some other anatomical abnormality affecting their teeth. If you like this video and would like to see more like it, please give it a thumbs up, leave a comment, and click to subscribe button.